Namaste. I am Dr. Professor G.G. Gangadharan, practicing at Bhadrappa layout near Hebbal in Bangalore. For last 40 years, I am in the clinical practice of Ayurveda. Skin or Twak in Ayurveda is one of the important protective tissue of the body. It has got 7 layers, starting from the external skin, the ectoderm, to the tissue that is touching the bone. 7 layers are there in the skin. And hyperpigmentation is one of the aberrations we see in skin metabolism. Hyperpigmentation causes kind of melasma, kind of change in the dark spot. That means there is something wrong in the skin metabolism. Here what we do is improving circulation, microcirculation, arterial circulation, which has to be increased by internal medication, which is improving the blood flow, and also by medicine which are improving the blood purity. The medicines of choice here are like Manjistha, Aragwadha, this kind of, and Nalpamaradi, that is Shirishadi. All these things are used. Nimba. These are used internally as well as externally. External application is one of the area of Ayurveda specialization, because we say Ayurveda does not have cosmetics. Ayurveda has cosmeceuticals. What does it mean is that it can make permanent change in the physiology of skin tissue. So when we do a kind of application of the skin melasma, for example, application of red sandalwood powder with unboiled milk, make a paste and applying it, it changes the skin texture by correcting the blood flow and metabolism of that skin area. There are many such examples. There are many materials we use for increasing the texture, pallor and glare of the skin. And skin has to be normally unctuous and should not be rough, should be shining, and it will be reflecting. Reflecting skin is the most hygienic and most healthy skin. So all the effort in Ayurveda is to make the skin more reflective, so that skin clears up. You have seen some people who just stand there, their skin will glow. This is because the metabolism of the skin tissue is to the maximum, or it is in the right direction. So for that we have at least 7 to 8 kind of procedures, starting with the scraping and punching and application of different material through boluses, and application of labas, and application of oils and gridams and other liquids. Kumkumadi Thailam is very common. This is a very good example of how melasma can be removed by application. One of the things that we should know about skin care is that skin has to be dealt with very mild and long lasting elements. It is not a one-day process. You have to slowly improve the skin texture, and you have to use appropriate things. For example, a Pitta-based person where there are more of acne kind of things are there. First you have to remove the internal reasons for acne formation by improving the metabolism, Agni level treatment, costa clearance, etc. Then treat the externally. If it is a Kapha person where sebaceous glands are present, more oil nature is there, then you have to give medicine which can remove that oiliness in the skin. For that we use things kind of thing. There are even simple materials like coriander powder in a combination can make the oily skin rough and more healthy. If it is a Vada where it is very dry and slightly splitting and the skin is so rough, that we have to make unctuated. So we have got facials which will increase that, improve circulations, and massage when you do it has to be do. There are more than 52 directions when you do a facial massage according to the facial muscles that are oriented towards different parts of the face. So if you know how to do that, you can improve circulation to that area by different kind of oil with warm or cold or room temperature, depending upon the skin type. You can improve the skin texture. So there are very commonly used materials for skin. One is internally Manjistha, externally Raktajandan, and even Kasturi Manchal kind of a turmeric, which is wild in nature, which is one of the very excellent thing to improve the skin texture. It has to be the procedure is little complex, but this is a very good remedy for skin texture.